Hey guys, it's Dr. Justin Marcagiani here. Welcome to today's live chat. Feel free to put your comments down below. We'll be doing a little coronavirus update and I'll answer your health questions as well. Put your comments down below. Let me know what you think. And if you're enjoying this content, give it a share. Let your friends and family know. Give it a thumbs up and make sure you subscribe. And if you want to reach out to me because you need more health support, I am here to help you. Links down below. All right, guys, so what's my thoughts on where we are at in the whole coronavirus pandemic issue? So number one is viruses tend to interact on this parabolic curve. It goes up, it goes down. Viruses typically always do that. And I think a lot of the fear is the unknown of how things are just going to go up and just continue to go up on this logarithmic scale and never come down. But we can see there's been over a dozen countries that have already been through it. We're over the hump right now. We kind of hit last week around April 10th. I said about April 9th to 11th, 2 weeks earlier. They were saying April 16th, so I ended up being a little bit more right than the experts. And I just compared us to Italy, and that's all I did, and I just framed it off of Italy. I was using China's stats, but I think they may be a little bit off. So Italy's stats, I think, gave me a better estimate. So again, the official government people that have been predicting this all along have been incredibly wrong. I think they were wrong for a lot of different reasons. We'll talk about why. The estimates were first at 2 to 3 million doing nothing, which I don't even think it would have ever gotten that high. That's my opinion because of the fact, well, if you strategize it and do it right and you get people to be asymptomatic that have antibodies, you create this massive herd immunity. Once you have about 60% of the population with antibodies, it's really hard for things to spread. So kind of my approach would be get the healthy people out there, get these people exposed to the virus, not necessarily sick, as 90% will be asymptomatic. So then you get this big buffer really fast. Okay, we're going to talk about that. My take on it's this. I'm going to give you guys a couple of perspectives. Let me review. Here's the general bell curve, okay, so you guys can see it. And the whole goal of why we want to social distance and quarantine, which makes sense for certain people, and we'll talk about that in a second, is we don't want the hospital system to get overwhelmed. So that's kind of why we social distance. The problem is you end up getting more people infected or you prolong the virus being around a lot longer. So you can see you stretch it out, right? You stretch it out here, but here you kind of one and done. So the benefit of being in this place right here is that you can get people out that are healthy. 90% are going to be asymptomatic. We know that based on many different studies, but I'll just give you guys one that you can see in the beginning to make sense of it all for you. Here's 86% will be asymptomatic. They will express no symptoms, but yet have an immunological response to it. And so the goal is you get them out here as fast as possible. Then you get this herd immunity. Once herd immunity, according to early studies, at about 58%, then it's harder to spread through the population because you get exposed to it and you have the antibodies. You are not going to be able to pass the infection along, right? You'll be infectious for that 2 to 3 week window in general. And then now there's this buffered herd immunity, natural passive immunity that happens when you get exposed to an infection. So this gentleman right here, I highly recommend everyone watch this video. You can Google him. His name is Dr. Professor Witowski. Now, he talks about it. He's got quite a background. You can go read about him. He's at Rockefeller University, Department of Biostatistics, Epidemiology, Research. This guy's super smart. But he's basically saying some of the things I'm saying. I listened to him. He really opened my perspective. Basically, his take on the whole thing is, hey, when you do it this way, you prolong it, right? Now, I understand the measure of like there being a certain amount of ventilators and overwhelming the hospitals, but I think we can go back and look at the data. We were never really that close. Maybe a little bit in New York City, but really throughout the country, a lot of hospitals were very much empty. And that's common sense because all other elective surgeries were closed. My mother's a surgical nurse and she still works in surgery, and lots of doctors, orthopedics, wherever, they're not working. They're not seeing patients unless it's an emergency. So you have a lot of other surgeries that would normally be going on that aren't happening. So it makes sense why a lot of hospitals are empty, but there are, of course, some in certain peak areas that are really over the top, right? So as long as we don't get to a level where we're overwhelmed here, then it makes sense doing it the way Dr. Witowski mentioned, right? Get people out there as fast as possible. And again, who are these people? These people are going to be healthy people without comorbidities, And of course, ideally not in that elderly population. People that have comorbidities, people that are older, you quarantine, you do all the right things there, and you get the people out that are healthier, that are contributing members of society, right? Because they're still at that age where they're working, and you get them asymptomatic. That's going to be one of the first things to do to prevent the spread of this. So again, my big thing is a lot of what's being talked about that you get out there is very much defensive medicine, defensive public health measures, which I understand, right? For certain parts of the population, it makes sense. Of course, wash your hands, social distance, quarantine for the exceptionally ill or immunocompromised. That makes sense. I think people do a lot of that anyway, but I think it's a good reminder. But now what else, right? We've already talked about a lot of the nutrients and the herbs and the things that we can do from a diet, lifestyle, and natural medicine supplement strategy. I won't go into it in detail today. Take a look at previous podcasts and videos on that. So I'm just trying to bring together a different perspective on how I'm looking at this, right? Hey, maybe this way would have been better. Maybe it would have been. But either way, I want you guys to think from the perspective of, hey, let's get herd immunity working for us. So as soon as we can get this economy open back up and we can legally get out there, depending on what state you're in, this is going to be helpful. And this should take away a lot of the fear of people getting sick or this respreading, because the more we have this herd immunity, it's going to create this protective barrier so things don't spread to other people. All right. Now, looking at the stats, of course, the stats are actually still going up on the mortality side. You can see we're at 4% for the real math. For the mortality rate here, and then the mortality for the rate for the world. So I'm sorry, this is the hysteria math. Hysteria math is 4.17%. Hysteria math for the world, 6.31%. Why is it hysteria math? Is because we don't know the number of total cases, right? When you do mortality, it's the top number over the bottom number, right? The problem is this number is unknown, right? It's going to be about probably 10 to 20x more than that number. That's why I call it hysteria. We know that with flu, right? Here's the top number in flu, right? 240,000. Here's the bottom number, but we know the top number is really 24 million, right? Does that give you a good idea of what that means when we say hysteria? Hysteria is just we have an unknown top number that's a lot higher than we actually know now, right? Hindsight's 2020. The other big concerning thing that I have here is on the diagnosis. We've already talked about this, but how COVID-19 is being diagnosed. And again, the virus is SARS-CoV-2. Just FYI, the disease is COVID-19. The big concern here is you do not have to necessarily get tested. You can actually just have the doctor can make their best decision that you are infected. And right here, here's the data right here. In case where a definite diagnosis of COVID-19 cannot be made, meaning you don't have a test, but it's suspected or likely, right? They are compelling a reasonable degree of certainty, it is acceptable to report COVID-19 death on a death certificate as probable or presumed. So they actually have two ICD-10 codes for this disease, one for probable or assumed and one for lab confirmed. So we have that as one layer that could amplify deaths. The other layer is going to be the false positive in the testing. And again, we have this one study right here showing that nearly half or more are asymptomatic and have a false positive. And up here, they even say up to 80%. The false positive rate was 80%. So those are my concerns. That's why I think the numbers here on the mortality side are going to be padded. And I've already showed you guys last week using CDC death stats is that the death rate overall for the country, as well as viruses, pneumonia, and flu, have actually dropped this season. So are those people getting bunched into that group? It's very, 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 very possible. Dr. Birx in the press conference last week said, hey, we're taking a liberal approach to diagnosing. She said, if you have a heart attack or a lung issue and you die of that, but you have COVID-19, we're going to add you to the COVID-19 death list. She said it with her own words. So we have to know that stats are going to be a little bit more on the padded side if that's going to be our approach to who gets labeled in the COVID-19 category. Does that make sense? I hope it does. Let me keep rolling with you guys. So we're getting over the hump. This brings a lot of comfort, guys. A lot of comfort. So let's go look at the U.S. So there's a general parabolic curve that we go through for all viruses. I already mentioned that here, right? This is the general curve, up and down. We do it for the flu. We do it with almost all viruses that we get exposed to. Check this out. Look at the daily new cases. I mean, look at this. We're already crescendoing here and coming down. This is great. Let's look at the deaths. The deaths are, look at that decline. That's a nice decline. We're moving on that downward track. That's exceptional. And again, remember, what you're not seeing here is there's also an increase on the asymptomatics. And that's what I'm trying to highlight for everyone is we get that asymptomatic group out there. That's going to really prevent the spread of this virus. It'll have nowhere to go. Not to mention, I've already talked about once May hits and we get summer weather, look at this, right? High temperature and humidity reduces the transmission of COVID-19. They looked at provinces in China that had higher populations. They looked at the temperature and the humidity, and the more the temp went up and humidity went up, guess what? The deaths went down. So this is deaths over here. This is temperature. Temperature went up. Deaths went down, okay? Viral transmission does not happen really well when it's humid and when there's more UVC light coming out. So you can see trending down. This is great. Let's look at Italy. Italy's about 10 to 2 weeks ahead of us. Look at the new cases. They're dropping down. That's wonderful. Let's go look at the deaths. They're trending down. This is exceptional. Let's look at the UK. So their new cases are definitely coming to that top and curving down the last 4 days. We can see that. And their deaths are as well. So I think the big concern is just the unknown, but you guys can see that things are moving in the right direction here. This is Netherlands, right? They're coming over that top here. They probably hit their top maybe April 5th or 6th. And let's look at their deaths. They're coming down. This is wonderful. South Korea, you can see, same kind of thing. Look at their daily new cases. And by the way, South Korea kept their economy open. Again, my general take on this thing is we should have kept our economy open, let the young and healthy stay out there. We should have made recommendations to boost the immune system. We should have allowed access for everyone to get vitamin C and vitamin D, made that available for people. I think if I was the president or if I was the dictator or the king of the world, right, that's what I would have done. I'd have made access to a lot of those good things, and I would have made some general healthy recommendations. But again, you know, it's tough, right? We have a lot of poor recommendations via the food pyramid and other things by a lot of governmental agencies. So it's hard to have a lot of trust. I get that. So South Korea cases, you can see that. And then you can see the deaths in South Korea. I mean, that's still trending down. You have a couple of little pops, but I mean, we're talking a scale of 0 to 10 here, right? That's, you know, the scale matters a lot. But you can see the trend is down and we're looking good. Brazil never closed their economy. Let's look at Brazil. Look at this. New cases up and then trending right back down. New cases up, deaths, and going right back down. So this should give you comfort. Let's look at Sweden. Sweden never closed down their economy. Cases are up. They hit their bell curve last week, and they're heading down with their cases. Let's look at the deaths. They're heading up and then right back down. Look at that. I mean, that's a nice drop. And India is really interesting because they are a very close quarter country, maybe not the best, you know, access to plumbing and cleanliness and those kind of things, especially in these big overcrowded cities. India, I mean, their daily new cases are up. They're at the top, but look at their deaths. I mean, this is, you know, at a factor of 60, right? And they're kind of on the way down a little bit. We need a couple more days to see that, but India's got over 1 billion people. I mean, you're telling me 358 deaths in a country over 1 billion? I mean, that's 3x of the United States. That's ridiculously low. So really a lot of good news here. And I kind of look at, you know, the countries that closed down and the countries that kept open. Right? I mean, if we look at that, I mean, the big countries that kept open that did well, I think Sweden did pretty well. Let's go find them here. I always sort by deaths per 1 million. That way you can compare smaller countries to larger countries. So Belgium, Italy, France, UK, Netherlands, Switzerland, right? Sweden. So Sweden did actually a tiny bit worse, but only one country in between. That's Bermuda. 74 people per 1 million versus 102. But again, overall, their total deaths were 1,000. Switzerland, a little bit more. They kept their economy open. Netherlands kept their economy open. And I'm comparing these because they're kind of similar size. Netherlands, Switzerland, Sweden, right? UK, Finland, they're kind of those G20 countries that kind of have similar size. So the fact that these countries they kept their economies open pretty well is very encouraging. And let's look at Brazil. Brazil kept their economy open as well. I know they were very, very low. Let me find them here. There's Brazil, 6 people per million. That's amazing. And then let's look for South Korea. Look at that, South Korea, 4. So, I mean, I think there are different ways to skin our cats here, you know. So I'm hoping that we have different approaches for the future and how we'll address these kind of pandemics. I really do. I like an offensive approach. Best defense is a good offense, and I like immune boosting strategies at the forefront and using social distancing as a reasonable response could be helpful, definitely for older people and multiple comorbidity people, as well as strict quarantine potentially for them. Oh, and then let's look at the whole idea of ventilators being maxed out. So I know New York had about 7,000 ventilators. They only peaked out at about 5,200 ventilators needed. So this number here, this is Chris Murray's model in New York. New York has about 7,000 ventilators, 4,000 in their stockpile, sent about 7. So they had about, I think, 7 to 11,000. So ventilators didn't seem to really ever be an issue in New York. And then I found this article on WebMD, and this really is concerning because it says United States has only about 200,000 machines. That seems like a lot of machines, considering New York only needed, what, 5,000, right? New York only needed 5,000 machines. And again, this data was by, let's see, this data was a pretty reputable source. Let me give you the source here so you guys can see it. This was the Society of Critical Care Medicine, an Associated Press report, 200,000 machines. But then we let's go look at the U.S. as a whole. And we'll do invasive ventilators. We only projected to use 14,000 max. So I'm a little perplexed because I'm looking at this data. How are we ever even close to maxing out our machines if we had 200,000 according to the American Society of Critical Medicine? I guess they were predicting 960,000 people were going to need it. But as you can see, at the max, it seems like invasive ventilators were at 14,000. So I'm a little perplexed. It seems like some people jumped the gun on this. And again, if you guys have data that conflicts with this, put the reference below. And then tomorrow I'll update my response based on new data. I mean, again, this is all dynamic. So I'm just using reason, logic, and evidence, knowledge guided by experience to bring you guys data, right? From my mouth to God's ears. That's it. So that's kind of what I'm looking at here, guys. Oh, and then one thing, someone corrected me here in the video yesterday. This is more, the shadow is the margin of error. It's not the actual need of ventilators. So I was using this as like the top need, how much we have in regards to ventilators. This is just the margin of error here that, regarding this projected number could go up. Okay, just kind of giving you that update from yesterday. And that's hospital resources, and then deaths are still they went up a little bit on the deaths. They were at 60,000 yesterday. They're back to 68. But you guys can see this should bring you comfort that we are following that predictable virus pattern. Also wanted to highlight a couple other things. Check this out. Mortality rate overall in other countries that have already done more data. This is a German study here. They found that 15% of their population, this is German, you got to speak German to know this. I don't, but I use Google Translate. 15% of the population actually were asymptomatic. And then if you look here, the mortality rate was 0.37% in Germany when they actually were able to run more studies, more data off of the asymptomatic population. So that's dropping down nicely, like I've been telling you guys. And then Iceland, really interesting study in the Daily Mail. I want to bring that to you. Iceland tested 1/10 of its population for coronavirus at random. So random, this is good because we're not just testing sick people, and found half of those who were half were positive with the disease, and they didn't even have the disease, so to speak. So without realizing. So half the people tested, realizing essentially means they had no symptoms. Half the population on average, based on that one sample, had the antibodies already. That's pretty amazing. And only 7 deaths in the whole country. So this is supporting this herd immunity. Get your antibodies up. Be asymptomatic, right? You're going to be infectious for that 2-week period, but then these antibodies are going to last for years after, which is pretty amazing. Just wanted to bring that data to you guys so you can see that what I'm saying has a little bit of backing. And researchers in Stanford are already seeing that as the potential issue in California, and why California's death rates were 15x below New York. Is because of the fact they already got exposed in December and maybe November, right? 7,000 Chinese people going from China to California every day. So that infection ran through California many months earlier, and you got herd immunity and antibodies sitting later. And also, talking about antibodies, if you or a loved one has this issue, think about getting plasma antibodies given to you intravenously if you're in the hospital and you are severely sick. That's very, very important. People were talking about the hydroxychloroquine and the azithromycin and the zinc. That's great. I like that. Get that zinc into that cell, help the apoptosis, decrease viral replication. I like that. Do all the immune boosting strategies. Be very careful of ventilators. If you need to be on a vent, loved one or another, talk to that pulmonologist or whoever that ICU doc or nurse is. Lowest level of pressure, highest level of oxygen. Even before that, it may be better to be using more oxygen and or maybe blood transfusion with hemoglobin in there, obviously from the fresh red blood cells, and IV vitamin C, as the virus is actually killing or destroying the hemoglobin, liberating lots of iron, creating a lot of free radical stress. So they're finding that it's more of a hypoxia thing, not a lung inflammation thing. And we need hemoglobin to transfer oxygen in our body. We need oxygen for the electron transport chain, for cellular metabolism, oxidation, etc. So it's very important. There's a different mechanism that we're seeing at play here, and some of the strategies before may not be the go-to ones with a lot of the ventilator stuff. And then just so you guys can see, let me pull this up. So how it works on average is about 80% of the population who gets exposed, or 80 to 90 will be asymptomatic. Out of that 10% to 15% that get the virus and have symptoms, 80% of those will be mild. And then out of the mild, or all the people that get infected, that 10 to 15% that get infected, you are going to see these numbers. Let me show you. You're going to see about 2.5% need to go to the hospital. COVID-19, 5% need to go to the hospital. 5% go to the hospital. Out of that 5%, 2%. Out of the people that go to the hospital, 2% ICU and then 1% ventilator. Okay, so we're talking a much, much smaller number in general, 80% mild, and then out of the 80%, the other 20%, we're looking at 5% overall, and then another 2% to ICU, 1% on a ventilator. So just kind of giving you that data there to keep it in perspective. All right, guys, I'll open it up for questions. Hopefully you guys are enjoying the content. Take comfort. Everything is working through like what always was designed to work through, right? There's a predictable pattern in how these viruses work through, and we're seeing it play through again. This should give you comfort to know that we're not going to just go off on this logarithmic pattern forever. Things are moving through and doing exactly what they need to be doing. Okay. Let me keep on rolling with your questions, guys. Sam writes in, good afternoon. Have you heard of nebulizing peroxide and iodine for treatment? Yes, Dr. Mercola talked about nebulizing peroxide, 3%. I'd be careful with it. I know it can be a little bit abrasive. I would definitely dilute it down. It may be worth it. And with iodine, same thing. I would look at a little bit of safety studies on it. I want to make sure the molecules are small enough and don't get trapped in your lungs or create any issues. I would just look at a little bit of the data on it, make sure it's good. But I would always over dilute with those things if you're going to try it, just to make sure there's no side effects. Okay. What do you think about taking activated charcoal on a fast? I think that could be helpful to kind of help clean stuff up. I like it. Only 14,000 cases in Texas with only a small percent of deaths. Why do you think Texas has so little cases? You think the weather's a factor? Yes, weather, UV light, that's all a factor. I also think that maybe some of these, there's herd immunity, right? There's definitely herd immunity going through there. And Texas is a little bit more spread out than other states, right? Texas is a lot more spread out. That could be a big, big factor. Certain states and parts of New York, obviously, where it got nailed, just things are a lot more condensed. Texas, we got a lot of land down here, which is nice. Certain parts, downtown Austin, downtown Dallas, downtown Houston, of course, but I think the weather and the humidity definitely aid in the spreading. Do you have any multivitamins on your website? Yes, justinhealth.com/shop. You'll see a little nutrient section. I have a multi-nutrient supreme capsule or multi-support pack. I do the multi-support pack every day for myself and my family. And that's the highest quality you can get. Minerals, vitamins, all chelated, bound to minerals, full spectrum, fish oil, etc. Best quality you can get. I appreciate your take on actually what's happening and sending out hope versus fear. Yes, you got it. And again, I don't want to blow air up anyone's shorts, right? This is real data. And if we have a context of where this data plugs in and what the pattern is, and if we look for that pattern to appear, then that gives us the predictability that we're on the right track and that there will be light at the end of this tunnel. I promise. Is OMAD a safe, viable option for long term? Been doing wonders for me over a year now. I'm not a big fan of OMAD long term just because it's very hard to get all the nutrients that you need in one meal. Like if I need 3,000 calories a day, I'm going to have a huge freaking meal to get 3,000 calories. So 2 meals, it's doable. 3, it's very easy. OMAD, it's really hard. You're going to have to probably spend an hour eating and chewing and doing all that stuff. But if you're going to use it, like you're going to let's say maybe you need 2,000 calories a day and you're going to get 1,000 or 1,500 in one meal and you're going to do it from a short-term kind of perspective, I think it's okay. I always tell patients that OMAD, go run your food through a chronometer. See how much you're actually getting at that one meal. And you'll probably be surprised that you aren't quite getting enough nutrients. But take a look at it. And if you want to use it therapeutically as a way to just give your tummy a break, fine. I like intermittent fasting better, and I like at least a 2-meal approach. It's much easier to get your nutrients in 2 meals. Chris writes into, hey doc, Chris S here, approaching 4 weeks on carnivore and stable on all new sups. Can I attempt adding some foods back in now? Yeah, if you're stable on all new sups and you're feeling good with everything and you've been doing well on carnivore, start with the lower FODMAP, lower salicylate carbohydrates, going one at a time. I would look at maybe carrots and butternut squash and maybe applesauce, and just start with those kind of foods on my SED combo list there, and then you can just kind of add those things in one at a time. Peel, cooked, mashed, sauteed is great. And again, if you are a patient, let me know, and I will give you guys preference on my chats and answer your questions first, and I will try to answer it even if it's off topic. That's my little service that I'm providing for my patients. Okay, great. Let me keep on rolling. Eggs, potentially, yeah. Just start with those start with the low FODMAP, low salicylates carbohydrates first, Chris, and then you can follow my diet reintroduction after if you're good. Could COVID-19 be a real planned excuse for a petrodollar, world governments to create money, corporations? I got to be careful on what I say in the chat. I don't want the AI to ban me. So could there be a greater conspiracy theory? It's possible, right? I always ascribe to Occam's razor with a lot of this stuff, right? I think a lot of things happen and then people try to take advantage of the situation. It's very possible, but I don't have any, evidence to refute that right now. Friend has been doing Xlear nasal rinse for bacterial pneumonia, nasal infection for about 2 weeks. Still congested. Doing ginger, glutathione, vitamin A, C, D, zinc, anything we can try to get the congestion down. So bacterial pneumonia, good. Infection about 2 weeks, still congested, ginger. Okay, so I don't really know where their diet's at. So I'm hoping the diet should be really good. And if they're really sick, I would lean on like a paleo, bone broth kind of soup kind of thing. And I would start from there. And then I would make sure you're doing NAC as well. And if you need to get the congestion down there, you can add the guanefacin in there, which is the herb that's in Mucinex, worst case, and then continue to flush. Had to do antibiotics for pneumonia. Again, there's no comments about your friend's diet, so I'm assuming that they're spot on there. But if you haven't started with that, that's essential. Okay, great. Esoteric writes, doctors and nurses admit COVID-19 financially taking over the proper classification and diagnosis of all patients for financial incentives. I have seen that. There is a big incentive right now. Yeah, $39,000 if someone's on a respirator. I think $13,000 per diagnosis of COVID-19. So anytime dollars and healthcare intersects, then there's pervasive incentives to diagnose people with that classification. So that is something that's concerning, right? That old adage, follow the money. I think that rings true here. What dose of glutathione would you recommend for preventative mode versus when having an infection? So if we're doing liposomal glutathione or an acetylglutathione, probably a good preventative would be like a 0.5 gram to 1 gram, and then you can go up to like 2 to 3 grams if you need more. Great questions. Given that COVID-19 damages hemoglobin and creates free iron, what are good ways to get rid of iron in the body? The problem is you could go give blood and do a therapeutic phlebotomy, but then you also lower your hemoglobin too. Do you see how the problem there? So you lower the hemoglobin and you're still going to be hypoxic. So I think you look at, it depends on how sick you are, right? If you're sick and you're having these issues and you're going hypoxic, you have a pulse oximeter and it's dipping below 90, it's going in the 80s or maybe even 70s, you may want to look at a blood transfusion. I would definitely be taking straight up oxygen, and I'd be looking at hyperbaric oxygen therapy, and I'd be doing plasma antibodies. I'd get someone that had the infection who's no longer infectious, and I'd get their antibodies. That's what I would look at doing. And then outside of that, I would probably doing an IV vitamin C, IV glutathione to deal with the oxidative load of all that iron being released. I think you could give blood and do a phlebotomy, but I think you lower the hemoglobin. That's the problem. Now, maybe you lower the hemoglobin acutely and then come in there with a phlebotomy, and then you come in with a blood transfusion afterwards. But that'd be something, you'd be in a hospital setting, and you'd have to talk to your hospital people to make sure that makes sense. But I may look at a therapeutic phlebotomy, get the iron down, and then bring some blood transfusion right in there afterwards, kind of blood going in on one side, blood going out on the other side. Maybe that could be a good option. But again, I'm not a trained medical doctor in an emergency setting. So talk to your person there. My wife has an ulcer that's acted up lately, but she's not sure what triggered it. In summary, what can we do to heal it? Follow my 6 R's. Remove the bad foods, replace the enzymes, acids, repair the gut lining and hormones. 4th R, remove the infections. 5th R, populate probiotics, good bacteria. 6th R, retest. Again, within there's a lot of things that we talk about and work on in regarding the adrenals, hormones, fixing the underlying stress that got your sympathetic nervous system wound up to get the ulcer in the first place. So it's kind of a couple of steps there, but head over to justinhealth.com. I have podcasts and videos on that topic, and you can search it there. Having heart palp, shortness of breath, experiencing small cough now, can feel a little irritation in chest and throat, feel fine, but want to take preventative steps. Started potassium, magnesium yesterday. That's the right stuff. I'd also start ginger tea and NAC as well. Okay, excellent. Usama writes in, can we add fruits like apples, sugar beets, guava, and kefir, and nutrients that are more bioavailable in IBS? It just depends on how good you're doing. If you're really stable, then you could definitely try it. If not, we always want to start from a place of stability before we start expanding. Matt writes in, Jay, on testosterone replacement, 40 milligrams EOD. What does EOD mean? Let me know what that means. Thyroid numbers look good, but libido seems to be lacking. DHEA helps a little. Any other suggestions? We need to do more labs. I always recommend, if you're going down the hormone route, look at the gut. Make sure the gut's working. Yes, diet is low carb, mostly veg and meat. Thank you. Yeah, then I would definitely lean on doing more soups and stuff to make it very easy on the tummy. Sip a lot of broth, keep it at that, and do those things that I mentioned. Can we use natto and fermented vegetables in start of a gut infection? In kombucha, have antimicrobial compounds, so is it a good idea to use these and combine with herbs to control gut infection? It depends. If we have SIBO, a lot of those probiotics, fermented food, may cause more bloating and gas and affect motility. So it just depends upon how you respond to those foods. If you do well with them and they don't aggravate or provoke things, it may be a good idea. Are there any iron chelators to remove excess iron? Are there things that we can do to remove excess iron? Yeah, there are things that can be done to remove excess iron. There are things, but I don't think it'll move the needle that much. Vitamin C typically increases iron, but the fact that the oxidative stress that's occurring from the iron, I think the oxidative stress that's neutralized from the vitamin C and the immune benefits outweigh the fact that it may increase iron. I think lactoferrin may also decrease iron too. It could either increase it or decrease it. I'd have to double check that. Let me check right now. Let me see if I got that. Yeah, okay. Got it. Yeah, lactoferrin provokes a significant decrease of iron. So lactoferrin may be a good option. Lactoferrin. All right. So we call it improv functional medicine here, guys. All right. You would repair before removing the infection or pathogen? Yes, I would. A lot of people have inflamed guts or intestines, and their nervous system is out of whack. So you got to calm that stuff down before we go and provoke and kill. If you can't get your hands on some vitamin C subs, what's your suggestion? Well, I got it. My website, justinhealth.com/shop. If you need vitamin C, you can always get it there and order from us, and we'll ship it to you. That's a good option. Outside of that, I would just be consuming lots of high-quality vegetables and low-sugar fruits that are loaded in those nutrients. I got a varicocele, varicose vein, spider vein, started at 20 along with discoloration of the legs over time. A potassium deficiency. Do you think these could be related? Potentially, maybe not. I see a lot of varicocele or vein issues, a lot of intra-abdominal pressure, a lot of potential gut stuff. I'd look there. Do you think young people who die of COVID-19 actually have pre-existing conditions that have not been diagnosed? What do you think can beat the virus? So, right, viruses have a hard time hanging out in healthy bodies. When you see a lot of exposés on healthy people, number one, there's a lot of people that are young and look healthy but have terrible health. Okay, I can tell you a lot of people that I remember in being in high school with, or even just people that I see now, do a lot of recreational drugs. They don't sleep. Their diets absolutely stink. They have a lot of junky fats. Their diet is so nutritionally poor. But you could still look okay on the outside. You could have a lot of nutritional deficiencies. You could be on a lot of methamphetamine, a lot of stimulants, a lot of medications as well. So looks could be deceiving. So you have to read between the lines, and a lot of exposés looking at an individual, it's not going to tell you what their comorbidities are, what their background is, what their health is. It's not going to give you a window into their daily life and their sleep and their food log. So you have to keep that in the back of your mind. But in general, statistically, 150 people die a year of the flu between 0 and 18, right? So you could do an expose every single day for 6 months during the flu season on these people. We don't see that happen, right? Why? Well, if you don't see it happen then and you see it happen now, it's because someone's trying to manipulate you and create fear. So statistically, it is low risk to even get it, and statistically, it's even lower to die from it. Do all the right things, make your terrain and your body stronger and more adaptable, and you'll have less of an issue. Okay. If you want to rotate PB, is it okay to use other nut butters? Potentially, if it's a minority. Does the line of Megaspore probiotics contain bacteria that can help break oxalates? Maybe. I think a lot of the Bacillus species can help with oxalates. Met a client last night. She's a healthcare worker, and she mentioned that she is consistently having strep throat. And other than removing her tonsils, is there anything else she can do to end the cycle? Yeah, if she's having continuous strep throat, I would be looking at diet changes. And again, that's like always foundational. It's kind of always assumed, but I don't know if their diet's good or not. I don't know about sugar, any of those things. Zinc lozenges, 10 to 30 milligrams a day of a zinc acetate or picolinate or glycinate is fine. A good ionic zinc is totally fine. I'd also do ginger tea, and I would also get like a really good ginger and manuka honey lounger. Weatherspoons makes one like that. That's really nice. Donating blood decreases iron and avoiding foids. It's been added to avoiding foods. Okay. So yeah, you could we already talked about that. The problem is you're going to lower your hemoglobin. So you got to make sure you're bringing hemoglobin in if you are decreasing iron. Again, this is more if you have an active COVID infection that your body is having a hard time handling. So I wouldn't do that for anyone. Does breastfeeding reduce the immune system and increase susceptibility to the virus? Even if diet is good, GF, dairy-free, organic foods, any recommendation, any subs? Well, if you're breastfeeding, do it because your immune system senses what's in the environment and you're going to make antibodies and pass it on to your baby. That's number one. And honestly, if you were getting a little sick, I'd pump a little bit and save some of that breast milk for you and get some of those antibodies back in you as long as the baby has what it needs first. But you could do vitamin C, vitamin D, and vitamin A is fine to do while breastfeeding as well. Maybe a little ginger as well. Pre-existing conditions that haven't been diagnosed, that would you say is the first step at fixing the diet, mostly meat, veg? Would you recommend to ensure you're on the right track? Yep, I would recommend all of that. You could do a functional glucose tolerance. You can do fasting insulin. Those are all good first steps. You could always test your adrenals and hormones. Okay, so you said meaning any first test we can do to make sure certain levels are where they need to be. Yeah, so the blood sugar testing, and we can always run like an organic acid or a good intercellular nutrient test like SpectraCell or NutriEval or an ion panel to look at nutrients too. That's helpful. All right, let me give some Facebook love here. Joanne writes in, why is this virus considered or referred to as a disease when it's self-limiting illness? So the virus is SARS-CoV, CoV. The disease is COVID-19. People are kind of conflating the two. And it is self-limiting. It really is. I mean, 98% of people will survive, and out of the people that actually get the infection, 10 times more actually got it and had no symptoms, which is kind of cool. Debbie writes in, morning from QLD, Australia. I'm doing radiation, just finished chemo. What can I take to boost my immune system? I've just recovered from a pneumonia. Yeah, so good luck here with that. Vitamin A, vitamin C, vitamin D here, Debbie, is a good first line approach for you, okay? Vitamin A, C, and D. Deanne writes in, I am thyroid cancer survivor and I am a premenopausal. I'm losing my hair. Could that be gut related? It definitely could be. I would look at it because all your nutrients flow through the gut. Deanne, vitamins, vitamin A, D, C, A, all your fat-soluble ones, which are A, D, E, and K, and then your water-soluble are B and C, and then, of course, all your amino acids and cholesterol all come through there, and they make your hormones. So we got to make sure those are stable. So if you want to reach out, you can reach out to me below, and we can talk about next steps. But definitely get your gut tested. All right, guys, what did you have for breakfast, and do you have a rotation for breakfast ideas? For me during the week, it's going to be coffee, 20 ounces or 20 grams of collagen, 1 tablespoon of butter, and 1 tablespoon of MCT oil. That's my breakfast every day. On the weekend, I will intermittent fast sometimes. And then lunch is going to be some kind of a meat and a vegetable and maybe a 1 serving of a low sugar fruit. And then I'll kind of rinse and repeat for dinner as well. Different color vegetables, different kinds of protein sources. Any guess if taking iron supplements be a good idea or a bad idea when having COVID? It depends. If you are anemic or you're a vegetarian, it could be a really good idea. All right. So it really just depend upon where you're at. It would also depend upon your oxygen saturation levels and how much oxidative stress you're having from the hemoglobin destruction. So acutely, it may not be the best idea, but you may want to look at a blood transfusion as some of that iron comes out. You may want to get some fresh blood back in. That could be an option. All right, excellent. Hey, Kathy, hope you're doing well. All right, great. Would lactose on the surface of a medication break my fast? Probably not. That's going to be too minor of a dose of sugar there that I don't think it'd be an issue. All right, great. Anything else, guys? Any other questions? I think I already answered my breakfast questions. I already answered all that. Excellent, guys. Put comments below if you're enjoying the content. Thumbs up. Really appreciate it. Comments below. Let me know if you're struggling with anything. I'd love to help you out. And I'll be back tomorrow. Take care, y'all.